Here's what we achieved in 2025.
We strengthened advocacy for the Global Fund's 8th replenishment, launching the Women for Global Fund Replenish the World campaign. We sent 64 advocacy letters to donor countries from 11 implementing countries, as well as the elaboration of a key donor analysis, regional priorities for women and girls, and a toolkit for a clear roadmap of actions and advocates. Women for Global Fund organized hybrid mentorship workshops in Cameroon, Malawi, and Uganda, led by national focal points. Together with ICW, we produced a feminist manifesto, What We Cannot Live Without, to secure women and girls' needs at the center of the response and help them navigate the Grant Cycle 7 process. We also made sure advocates seeking to be effective CCM members now had our handy guide available in Spanish and French. We highlighted FGS as a critical issue to be linked into HIV and SRH services, integrating them into Global Fund's gender transformative approaches. We strengthened advocacy, fostering the need for sustained investment in harm reduction policies, programs, and practices at the global spaces, including the Harm Reduction International Conference in Colombia and INSU Conference in South Africa. We joined allies for the Global Day of Action, Support Don't Punish, leading community dialogues connecting HIV, TB, drug policy, and human rights, and amplifying feminist leadership. We led a workshop at Innovación Positiva Week in Bogotá on feminist political advocacy and centering women in all their diversity within Global Fund processes. In Ecuador, together with TB CAB, we sustained advocacy efforts addressing and calling for coordinated responses on the TB crisis in detention centers. We grew our network and launched the Asia Pacific Advocacy and Learning Hub with 25 advocates. In partnership with Data Etc., we delivered a multilingual webinar series to support advocates and civil society in using Global Fund data for stronger advocacy efforts. At the World Health Summit, we co-hosted an official side event with Unite Parliamentarians, frontline aides, and partners, bringing together parliamentarians, communities, and civil society to advance gender transformative community-led responses to AIDS, TB, and malaria. During the 16 days of activism, we amplified our Fund Her Health campaign, calling for investment in HTM responses to break down barriers linked to gender-based violence. Overall, we published 11 advocacy statements and brought women and girls' voices to 56 global forums, conferences, panels, and learning spaces. When global investments fall short, gender equality, human rights, and community-led action are non-negotiable. Funding feminist, community, and women-led health responses protects progress and saves lives. None of this would have been possible without you. Thank you for your leadership, commitment, and solidarity. In 2026, we will continue together, standing with women and girls in all their diversity and calling to invest in what matters most.
There is still a lot of work ahead, but we remain committed to achieving a world where women and girls in all their diversity can access gender transformative care and HIV, TB, and malaria services.